Oh, welcome back. I'm Dr. Sean Lauderer, and today I would like to talk to you a little bit about a condition that I see often in my office, and most recently, which prompted me to make a video about this, and it's a condition known as carpal tunnel. Carpal tunnel. Carpal tunnel syndrome, as the medical doctors like to call it. Syndrome is usually a word that's used to instill fear into their patients that would often warrant surgery for this type of condition, when really all it is a condition, and conditions can change. And I'm going to show you how. So, carpal tunnel, what is it? First of all, understanding the anatomy, there are ligaments that run across the wrist, and the ligaments that surround the nerves and the blood vessels supplying feeling and blood flow to the hand often gets contracted. It starts to contract and it squeezes those nerves and blood vessels, and it often causes pain and numbness and tingling. Okay, so how does this happen? It's basically just repetitive stress injuries, things that you do over and over for a long period of time. These are called repetitive stress injuries. Data entry, keyboard operators, hairstylists, folks that are all like this, generally, with the head tilt and the repetitive movements, oftentimes see carpal tunnel symptoms. So, how do you know you have carpal tunnel? A couple of quick tests. One, you put your fingers like this, right, and you squeeze them and you try to pull them apart with a strong hand. If it feels like it's too weak and you can't hold your fingers together, this could be an indication that you have carpal tunnel. Another thing, put your wrists together like this. If doing this increases numbness and tingling symptoms, there's a strong possibility that you have carpal tunnel. Okay, so what do we do about it? Besides surgery, oftentimes surgery is not necessary because this is a very easily corrected condition. First of all, you have to align the bones of the wrist. You've got 7 individual bones in the wrist. You get them aligned here. You get the elbow, the shoulder, and the spine aligned. You take all the pressure off of the nerves and you create a clear pathway from the source to the hand. That's the main thing. But what can you do? 2 things. 2 really easy, simple exercises to do for carpal tunnel. Okay, ready? Watch this. Palm up. Palm up. Pull your fingers back. Look at that. Take a deep breath and exhale. Hold this for about 5 deep breaths. Okay? So what you're doing is you're stretching those ligaments that control and house the nerves and the blood vessels. Okay? That's 1. Number 2, palm up, palm down. And reach around and pull your fingers back. Like this, okay? Now, you're stretching the opposite side, just like this. Hold it for 5 deep breaths. Remember, the elbow is straight and flex the fingers, okay? Hold each stretch for 5 deep breaths. Remember, please, the breathing is so important. It's the one that gets oxygen into your blood. And this is going to increase blood flow as well as stretch the ligament that holds those. So do this often as you can. You can do that when you're sitting at your desk. You can do this on your break. You can do this watching TV. Do this anytime. And watch your conditions change. And that's really the point of this video I wanted to make. I want you guys to understand, if you take anything out of this, conditions can change. And it's up to you. I hope you enjoyed this. Give us a like. Message me if you have any questions. If you want me to talk about any other condition, I would be glad to. I love you guys. Thank you for following me. And I'll see you next time. Bye.